From tragedy to triumph, how one woman's cancer journey sparked a health revolution. Welcome to the BlackCEO Podcast, where we explore stories of resilience, innovation, and transformative leadership. I'm your host, and today we're diving into a narrative that will challenge your perceptions, ignite your passion, and quite possibly change the way you think about health, community, and the power of one person to create a ripple effect of positive change. Before we begin, I want to acknowledge the extraordinary individual whose insights and experiences form the backbone of today's discussion. Novice McDaniel is not just a breast cancer survivor. She's a visionary, a community leader, and a force of nature who has single-handedly revolutionized the approach to women's health in underserved communities. Her journey from patient to powerhouse is nothing short of awe-inspiring, and the impact she's had on countless lives is, quite frankly, staggering. Novice doesn't just talk about making the world a better place. She rolls up her sleeves and gets it done, one innovative initiative at a time. Now, so buckle up, folks. We're about to embark on a journey that will take us from the depths of a devastating diagnosis to the heights of community transformation. And trust me, by the end of this talk, you'll be looking at your own potential to change the world in a whole new light. Now, let's set the stage. Picture this. You're sitting in a doctor's office, the antiseptic smell burning your nostrils, the tick of the clock on the wall suddenly deafening, and then you hear it. Those three words that no one ever wants to hear. You have cancer. For Novice McDaniel, this wasn't just a hypothetical scenario. It was her reality. But here's where the story takes an unexpected turn. Instead of retreating into fear and despair, Novice did something remarkable. She looked cancer in the eye and said, "You picked the wrong woman to mess with." Now, I can almost hear some of you thinking, sure, that sounds brave, but come on, who actually reacts like that? Well, let me tell you, Novice McDaniel does, and her reaction wasn't just about personal bravery, it was the spark that ignited a revolution in women's healthcare and community empowerment. You see, Novice didn't just fight her own battle with cancer. She looked around and saw a system that was failing countless other women, particularly in communities of color. She saw the lack of awareness, the barriers to access, the social and economic factors that were literally killing women. And she decided that wasn't acceptable. So what did Novice do? Did she start a support group, organize a fundraiser? Those are noble efforts, sure, but the Novice's vision was far more ambitious and, dare I say, radical. Novice recognized that to truly combat breast cancer and empower women, we need to address the root causes of health disparities and social inequities. She understood that knowledge is power, but only if it's accessible and actionable. And let me tell you, the way she went about making that knowledge accessible and actionable is nothing short of genius. First, Novice tackled the awareness problem, but she didn't just put up some posters or hand out brochures. No, Novice got creative. She looked at her community and thought, where do women gather? Where do they feel comfortable? Where do they share and receive information? The answer, beauty salons. Now, I can see some of you raising an eyebrow. Beauty salons, really? But think about it for a second. In many communities, especially communities of color, beauty salons are more than just places to get your hair done. They're community hubs. They're where women gather, gossip, share advice, and support each other. So Novice partnered with local beauty salons and trained hairstylists to be health ambassadors. Can you imagine? You're getting your hair done, chatting about the latest neighborhood news, and suddenly you're learning about the importance of mammograms and how to do a breast self-exam. It's brilliant in its simplicity and effectiveness. By meeting women where they already were and leveraging existing community relationships, Novice was able to disseminate life-saving information in a way that felt natural and non-threatening. But Novice didn't stop there. Oh no, she was just getting started. She recognized that knowledge alone isn't always enough to drive action, especially when faced with systemic barriers to healthcare access. So she took on the healthcare system itself. And let me tell you, taking on a system as entrenched and complex as healthcare, that's not for the faint of heart. Novice began advocating for mobile mammography units to visit underserved neighborhoods. Now, think about the impact of this for a second. For many women, getting a mammogram isn't just a matter of making an appointment. It's about taking time off work, finding childcare, figuring out transportation. These aren't just inconveniences, they're often insurmountable barriers. By bringing mammography units directly into communities, Novice was literally saving lives. Women who might have put off screening for months or even years were now able to walk down the street and get this crucial preventive care. But Novice didn't stop at improving access to screening. She tackled the financial barriers head on. She worked tirelessly to establish partnerships with local hospitals and clinics to provide free or low cost mammograms to uninsured and underinsured women. Now, I can almost hear some of you thinking, that's great, but how many women is this really helping? Well, let me share some numbers with you. In the first year of this initiative alone, over 5,000 women received free mammograms. Of those, 73 cases of breast cancer were detected early at a stage where treatment is most effective. That's 73 lives potentially saved. 73 families spared the trauma of losing a loved one too soon. But here's where Novice's approach really shines. She didn't just set up these services and expect women to show up. No, she created a network of community volunteers who would provide childcare, transportation, and even accompaniment to appointments. Imagine for a moment what this means. You're a single mother working two jobs to make ends meet. You know you should get a mammogram, but how? Who will watch your kids? How will you get to the clinic? How will you navigate a healthcare system that often feels confusing and intimidating? Now imagine this. A volunteer from your own community shows up at your door. She offers to watch your children. Another volunteer is ready to drive you to your appointment. And when you arrive at the clinic, there's someone there to hold your hand, to help you understand what's happening, to be your advocate. This is the kind of comprehensive, compassionate approach that Novice implemented. She understood that sometimes the biggest barrier to healthcare isn't the cost or the availability, but the fear and uncertainty of navigating the system alone. The impact of this approach has been nothing short of transformative. In communities where Novice has implemented these programs, we've seen mammography rates increase by over 60%. Early detection rates have skyrocketed. But more than that, we've seen a shift in how women in these communities think about their health. They're more empowered, more informed, more proactive. Now, I can almost hear some of you thinking, that's all well and good, but what about prevention? Isn't that the real key? And you'd be absolutely right. This is where Novice's work takes on an even broader scope and where things get really exciting. Novice recognized that true prevention goes beyond just breast cancer. It's about overall health and wellness, which are inextricably linked to socioeconomic factors. She understood that you can't talk about health without talking about things like access to healthy food, safe spaces for physical activity, and clean environments free from pollutants that can increase cancer risk. So what did Novice do? She partnered with local farmers to bring fresh produce into food deserts. She worked with city planners to create more green spaces and walking paths. She even took on corporate polluters who were disproportionately affecting low-income neighborhoods. Now, I know what you're thinking. Wait a minute. We started talking about breast cancer, and now we're talking about urban planning and corporate accountability. How does this all fit together? Well, that's the beauty of Novice's approach. She understands that health doesn't exist in a vacuum, that you can't address one health issue without looking at the bigger picture, that true prevention and true health equity require a holistic, systemic approach. But perhaps one of Novice's most innovative initiatives, and the one that I find most exciting, is her focus on economic empowerment as a path to better health. Now, at first glance, you might wonder what economic empowerment has to do with breast cancer prevention. But stick with me here because this is where things get really interesting. Novice understood that financial stress and job insecurity can have profound impacts on health, both directly through increased stress and indirectly by making it harder to prioritize things like preventive care and healthy lifestyle choices. To address this, Novice established a program that provides job training and entrepreneurship support to breast cancer survivors and women at high risk. The program not only helps women gain financial stability, but also creates a network of support and mentorship. Imagine the power of this for a moment. A group of women who have faced similar health challenges coming together not just to support each other emotionally, but to build businesses, to create economic opportunities, to lift each other up financially as well as spiritually. One of the participants in this program, let's call her Maria, shared a story that I think perfectly illustrates the impact of this approach. Maria had been diagnosed with breast cancer at 42. She was a single mother working a minimum wage job with no health insurance. The diagnosis was devastating, not just because of the health implications, but because she didn't know how she would afford treatment, how she would support her children if she couldn't work. Through Novice's program, Maria not only received the medical care she needed, but also received training in small business management. Today, 3 years cancer free, Maria runs a successful catering business. She has health insurance, she's able to afford healthy food for her family, and perhaps most importantly, she's become an advocate in her community, sharing her story and encouraging other women to prioritize their health. This is the kind of multifaceted, lasting impact that Novice's approach creates. It's not just about treating a disease, it's about empowering women, strengthening communities, and creating a cycle of positive change that ripples out far beyond the initial intervention. Now, I know what some of you might be thinking. This all sounds great, but surely one person can't do all this alone. And you're absolutely right. Novice's genius lies not just in her ideas, but in her ability to inspire and mobilize others. She has a remarkable talent for building coalitions, bringing together diverse stakeholders from healthcare providers to community leaders to corporate partners. Novice often says, if you want to go fast, go alone. If you want to go far, go together. This African proverb encapsulates her approach to creating lasting change. She doesn't seek to be a lone hero, but rather to empower others to join in the fight against breast cancer and for women's health equity. One of the most powerful aspects of Novice's work is how she centers the voices and experiences of the women she serves. She doesn't presume to know what communities need, but instead creates platforms for women to share their stories, express their needs, and contribute to solutions. This approach not only leads to more effective interventions, but also builds a sense of ownership and empowerment within the community. Novice's work reminds us that true change doesn't happen in silos. It requires a holistic approach that addresses not just the medical aspects of breast cancer, but the social, economic, and systemic factors that contribute to health disparities. It's about creating a world where every woman, regardless of her race, income, or zip code, has the knowledge, resources, and support she needs to prioritize her health and well-being. But let's be clear, Novice's journey hasn't been without challenges. She's faced skepticism, bureaucratic roadblocks, and moments of personal doubt. There have been times when the magnitude of the problem seemed overwhelming, when progress felt slow, when doors seemed to close more often than they opened. Yet, it's in these moments that Novice's true strength shines through. She has a remarkable ability to find hope and opportunity even in the darkest situations. Novice often shares a story about a particularly difficult period when funding was scarce and she was considering giving up. She went for a walk in her neighborhood feeling defeated when she came across a group of young girls playing double dutch. As she watched them jump and laugh, she was struck by a realization. These girls, full of life and potential, were the reason she couldn't give up. Every jump of the rope represented a heartbeat, a life that deserved the chance to thrive, free from the shadow of breast cancer. In that moment, Novice found renewed determination. She went back to her office, picked up the phone, and started making calls with fresh energy and purpose. This ability to find motivation in unexpected places is a hallmark of Novice's approach. She has a gift for helping others see the extraordinary in the ordinary, to recognize that every interaction, every conversation, every small act of kindness or advocacy can be a step towards positive change. Novice's work also challenges us to rethink our understanding of leadership. In a world that often celebrates loud, charismatic leaders, Novice demonstrates the power of quiet persistence, of leading by example, of prioritizing impact over recognition. She shows us that true leadership is not about having all the answers, but about asking the right questions and bringing people together to find solutions. One of the most inspiring aspects of Novice's approach is her emphasis on joy and celebration, even in the face of serious challenges. She understands that fighting breast cancer and health inequities is a long-term battle, and that to sustain the energy and commitment needed, we must find ways to celebrate every victory, no matter how small. This philosophy is embodied in the annual Pink Power Walk that Novice organizes. It's not just a fundraiser or awareness event, though it certainly serves those purposes. It's a celebration of life, of community, of the strength and resilience of women. Picture thousands of people dressed in every shade of pink imaginable, walking together through the streets. There's music, dancing, laughter. Survivors share their stories, not just of struggle, but of triumph. Women who've recently been diagnosed find hope and support. Families honor loved ones they've lost while committing to a healthier future. The event is a powerful reminder that in the fight against breast cancer, we're not just battling a disease, we're celebrating life, honoring our bodies, and coming together as a community. It's a vivid illustration of Novice's belief that joy and purpose are not just compatible, but mutually reinforcing. Now, as we near the end of our time together, I want to challenge each of you to think about how you can apply Novice's insights and approach in your own lives and communities. You might not be tackling breast cancer specifically, but I guarantee there are issues in your world that could benefit from this kind of holistic, community-centered, persistently hopeful approach. Maybe it's addressing food insecurity in your neighborhood, or advocating for better mental health resources in your child's school, or working to make your workplace more inclusive and equitable. Whatever it is, I encourage you to think beyond the obvious solutions. How can you leverage existing community strengths? How can you bring diverse stakeholders together? How can you address not just the symptoms of the problem, but its root causes? Remember Novice's example. Start where you are, use what you have, and don't be afraid to get creative. Your beauty salon could become a hub for health education. Your neighborhood park could be the birthplace of a community wellness initiative. Your social media platform could be the spark for a movement. And most importantly, don't go it alone. Build your coalition, find your tribe. Remember that lasting change happens when we come together, when we recognize our shared humanity and our interconnectedness. As we wrap up, I want to leave you with one of Novice's favorite quotes. She often says, "We are each other's harvest. We are each other's business. We are each other's magnitude and bond." These words from the poet Gwendolyn Brooks encapsulate the spirit of Novice's work and the challenge she poses to all of us. We are indeed each other's harvest. What we sow in our communities, we will all reap. We are each other's business. The health and well-being of our neighbors, our co-workers, our fellow citizens is our concern and our responsibility. We are each other's magnitude. Our potential for impact is multiplied when we work together, and we are each other's bond, connected by our shared humanity and our shared hope for a better world. So as you leave here today, I challenge you to carry Novice's spirit with you. Look at the world around you with fresh eyes. Where do you see need? Where do you see opportunity? How can you be a force for positive change? Remember, you don't have to have all the answers. You just have to be willing to ask the questions, to take that first step, to believe in the possibility of change. Start small if you need to, but start somewhere. Maybe it's as simple as checking in on a neighbor, or volunteering at a local health clinic, or advocating for healthier food options in your workplace cafeteria. But don't stop there. Think bigger. How can you leverage your skills, your resources, your connections to create lasting change? How can you be a Novice McDaniel in your own community? And here's a radical thought. What if we all did this? What if we all looked at the challenges in our communities not as insurmountable problems, but as opportunities for innovation and transformation? What if we all approach these issues with the same creativity, persistence, and compassion that Novice has shown? Imagine the world we could create. A world where health equity isn't just a lofty goal, but a lived reality. A world where your zip code doesn't determine your life expectancy. A world where every woman has the knowledge, resources, and support she needs to prioritize her health. This isn't just a dream, it's a possibility. And it starts with each of us here today deciding to make a difference. So I ask you, what will be your beauty salon moment? What innovative approach will you take to address a challenge in your community? How will you build your coalition, find your tribe, create your movement? The answers to these questions have the power to transform not just your life, but the lives of those around you. They have the power to create ripples of change that extend far beyond what you might imagine. Just as Novice's personal battle with breast cancer blossomed into a movement that has touched countless lives, your individual actions and commitments can spark changes that resonate through your community and beyond. Remember, change doesn't always come in grand gestures or sweeping reforms. Often it's the accumulation of small actions, of consistent effort, of unwavering commitment to a vision of a better world. It's in the conversation you have with a neighbor about the importance of preventive health care. It's in the support you offer to a friend going through a tough diagnosis. It's in the letter you write to your local representative advocating for better health policies. It's in the example you set for your children by prioritizing your own health and well being. Novice's work reminds us that we all have the power to be change makers. We all have spheres of influence, no matter how small they might seem. We all have unique perspectives, experiences, and skills that can contribute to solving the complex challenges our communities face. So today I'm calling on each of you to be a Novice McDaniel in your own right, to look at the challenges around you not as insurmountable obstacles, but as opportunities for innovation and positive change, to approach these challenges with creativity, persistence, and above all, compassion. I'm calling on you to build your coalitions, to leverage your strengths to think outside the box, to recognize that true change requires addressing not just symptoms, but root causes, to understand that health isn't just about medical care, but about creating environments and communities that support well-being in all its forms. I'm challenging you to be bold in your vision, but humble in your approach, to listen to the voices of those most affected by the issues you're trying to address, to celebrate small victories while keeping your eye on the bigger picture. And most importantly, I'm urging you to start now. Not tomorrow, not next week, not when you feel more prepared or when the timing seems right. Now, because the truth is, there's never a perfect time to start changing the world. There's only now. So what will you do with this moment? How will you contribute to the harvest of our shared community? How will you strengthen the bonds that connect us all? The world is waiting for your unique contribution. It's waiting for your beauty salon moment, your innovative approach, your unwavering commitment to making a difference. Remember, you have the power to transform lives, to reshape communities, to change the narrative. You have the power to be the Novice McDaniel of your world. So go forth with courage, with compassion, and with the unwavering belief that you have the power to make a difference. Because you do, we all do. And together, we can create a world where every person has the opportunity to live a healthy, empowered, and purposeful life. The time for change is now. The person to lead that change is you. Are you ready to answer the call? Thank you.